Good morning, everyone, and welcome. On behalf of Safaricom Business and Savannah Informatics, we are delighted to have you with us for today's webinar. The theme is Digitizing Healthcare, Building a Resilient Healthcare Ecosystem. My name is Millicent Osano, and alongside my co-host, Nicholas Ingosi, will be your host for today's session. Whether you're joining us from a hospital, a clinic, a healthcare organization, or as one of our valued partners, thank you for taking the time to be with us. Nicholas, over to you.
Yeah, good morning, everyone. And it is a pleasure to join you today across the healthcare sector. Digital transformation is no longer a future aspiration. It is an essential step towards improving efficiency, ensuring compliance, and ultimately delivering better patient outcomes. So today's webinar has been designed to explore how innovative health management information systems can support healthcare providers in navigating through this journey while building a more connected and resilient healthcare ecosystem. Make sense? Millicent, you're on mute.
Sorry for that. Throughout the next 90 minutes, you'll hear from industry experts from both Safaricom Business and Savannah Informatics as they share insights on current healthcare landscape, the importance of compliance, our HMIS solution, and how your organization can begin its own digital transformation journey. We'll also have an interactive quiz and a live Q&A session, so we encourage you to stay with us until the very end. Nicholas?
Right. So before we get started, we'd like to take you through a few housekeeping reminders to help ensure everyone has the best possible experience throughout today's webinar. Kindly keep yourself muted throughout the session. 2, please submit your questions through the Q&A or chat functions at any time. 3, the session is being recorded and presentation material will be shared after the webinar where applicable. Then lastly, we're encouraging everyone to stay until the end where we will share registration information for the HMIS platform. Now, let's do a short Menti to gauge the room.
So just to gauge what your current expectations for this webinar will be, kindly scan the code so that we are able to just ask you 2 questions to set the mood. Kindly give me a thumbs up if you already scanned the code. Thank you. So describe how you're feeling this morning in one word. I can see happy. Hello. Excited, awesome, amazing. Thank you for that. Fabulous, motivated, refreshed, energetic. Some are cold. Sorry for that. For those who are sleepy, this session is about to be amazing. So please buckle up. Anticipatory, cool, fresh in mind. Thank you guys so much. Wow, lovely. Okay,
So we
we
have
can move to the
outcomes.
next question. Yeah, thank you. So what are your expectations for today's session? I see clarity. I see to learn more. Keep going, guys.
That is to
More
learn more on
info.
HMIS, why Safaricom and Savannah. Wow. More info on HMIS, a productive session, gain knowledge, opportunities. This one is a big one. More info about the tool. Very informative, but check on the sound. A lot of echo behind. Understand better the product, to learn the new updates on slide 360. The MICE update, learn. Information, gain more interest in HMIS. So it's just about knowing the solutions better and how the solution will impact the lives. More so here, we are looking into making the patient journey much easier and much accessible to the providers. How does this work for solo practitioner? You get those answers as you go along. Practical experience. Yeah, Vincent, I think we.
Thank you so much for participating in that particular session. So as we move into the next, as we start kicking off into our webinar, I believe I'll hand over back to Ngozi for some partner contexts and introductions from Safaricom. Thank you.
Thank you very much, Millicent. And welcome all those who had not joined earlier. So we are officially kicking off, and I would like to invite our first speakers to introduce this collaboration. And as we know, digital transformation succeeds through strong partnership. And to provide context on today's collaboration and vision behind this initiative, please join me in welcoming Dr. Job Nyamieno, and together with Boniface Mungania. Dr. Job.
Thank you. So good morning, everyone. You can have the slides on screen. So good morning once again. My name is Dr. Job Nyangana. I'm a medical doctor and digital health professional, and I lead the digital health team at Safaricom under public sector digital transformation led by our director, Boniface Mungania. So why are we here today? We're here today to go through our offering that is supposed to support facilities to align with the new direction that has been given by the Ministry of Health and the agencies such as the Digital Health Agency and the Social Health Authority. And this is the move towards complete digital transformation of the health sector. In the Mentimeter, someone asked, they want to see how Safaricom and Savannah are working together. So this partnership brings two industry leaders from the technology and the health technology side. So from Safaricom, we're bringing a lot. We all know Safaricom is strong in connectivity, in cloud, financial services. But as I mentioned earlier, I'm a medical doctor. We've set up a health team at Safaricom. We have over 50 professionals, doctors, pharmacists, health economists, software engineers who've worked in the health sector for over a decade. And so we bring a wealth of experience from technology and the health sector, and also the traditional Safaricom strengths, as I mentioned earlier. On financial services, we've become very strong on public sector delivery. We're very strong on enterprise support, digital transformation, and service excellence. And our partnership with Savannah is based on their strengths as an industry leader in the health technology sector, where they've had more than a decade of experience in the insurance technology sector. They have a wealth of experience from a clinical perspective, integration of different systems through information exchanges and the electronic data interchange, wealth of experience in data analytics, digital health transformation, and service excellence. So we're bringing the best of both worlds from health and technology. And this is to support you to manage your fears, especially with the new direction that the Ministry of Health has given. You may be wondering what next for us, and we have the answers. Next. And so what is this direction that the Ministry of Health has set? It is that we're supposed to move to the digital health superhighway, and all new contracts by SHA going forward will now need facilities to be integrated. But how did we get here? One, in 2023, we had several laws that were passed that reformed the health sector. And then, so we had the Social Health Authority replacing the NHIF with coverage widening to include the whole public, so it is mandatory. And then all the insurance or the claim activities were moved onto national rails. So especially for SHA, eligibility, authorization, and claims have been transacted digitally since then through the provider portal. But now there's a move towards integrating directly from your HMIS. Third is we are now, as a country, based on from the Digital Health Act, it mandated the establishment of the Digital Health Agency, which is the regulator in digital health. And so it is supposed to set the standards that allow you to get certified, data governance for health data. And so this regulator now provides the governance needed to have a properly regulated digital health ecosystem. And so with all this in place, the direction came that we now need to go digital fully when it comes to claims. And so on the 30th of June, the Ministry of Health, led by the Cabinet Secretary, announced that we need to move from manual, from the provider portal to direct integrations of the HMISs to the digital health superhighway that is managed by the Digital Health Agency. And so while before digital transformation was a preference for forward-looking hospital administrators, it's now a regulatory compliance. And so a facility without a compliant HMIS will struggle to fit into the ecosystem, and which will bring pain to their customers and or their clients. Next. So in this session, we're going to take you through what our offering is, our solution that will allow you to be in line with the requirements of the government. But more importantly, it will help reduce the pain you're experiencing on different aspects of the operations in your facility. So what are you going to get out of this? Number one, a clear answer on whether you must act and why. So what compliance truly means. We will get a description of the HMIS at a high level. We'll have individual sessions at your facilities at your request, virtual or physical, to take you into more detail of the platform. And it will be the next step. So before you go, we're going to request you to register so that we can follow up with you to take you further into our offering. And we're bringing both all the offerings that Safaricom can give you, plus this hospital-specific solution that we have. And what is this? What will you not get out of this? One, it's not a live demonstration because that will take too much time. We only have 1.5 hours, but we can follow up with you after this. It's not a contract conversation. That will be a great facility based on your needs. And it's not a request for you to abandon your system. If you already run a HMIS, it can undergo DHA certification. If it fits, then you're good to go. If not, then we can support you in ways that will be described in this webinar. So I'm really looking forward to this. I'm excited. You're going to get a lot of value out of this session. It's going to reduce the anxiety you may be having currently and any potential panic you may have about the timelines, about what is expected of you as a facility. Because we are a team that is very experienced in this. We understand what the government wants, we understand the ecosystem, we understand the infrastructure, and we can support you in many ways. Even beyond the solution itself, we can support you in a facility assessment on your IT needs. What, if you don't have a system, what will it take from a hardware or infrastructure perspective to have this solution? So, if you don't have connectivity, we can support you on that. So after this, you should feel very comfortable that you have partners that can support you in everything that you want to do to comply. Back to you, Nicholas.
Yeah, thank you very much, Daktari, for setting up the stage. Now we've understood what the product is bringing in, and now we know the vision of this initiative. So we'll go ahead and start exploring what the healthcare providers should expect from today's sessions, and which Dr. Job you've already handled and given light to that. So Millicent.
Thanks so much. We appreciate all those insights. I think what we've garnered is one of the biggest drivers behind healthcare digitization is just changing the compliance landscape. So in our next session, we'll be having a look. Kindly join me in welcoming our Chief Executive Officer, Dr. John Muthe, who will discuss the compliance mandate and address some of the common concerns healthcare providers have regarding compliance. So thank you, Dr. Karibu.
Thank you. Thank you, Millicent, and good morning to all the esteemed guests from hospitals, from the health insurance, from consulting firm, data platforms, and especially our longtime partners, our vendors. And I know most of you have called me, most of you have asked me what's happening, and I think it was easier to have all of us in one session webinar, and we look forward to even more of this. So I'll say that even as we look forward to the upcoming deadlines and the like, I think people are asking what's changing. And the first thing is that, well, through the SHAP provider portal, there was a lot of double work and you could attach documents and the like. I think the part that we are looking is whereby there is less double work. And even for us as Safaricom is how do we help with a pathway that you can support your patients, your schemes, and the like into certification and also into compliance. If you could go to the next slide. And as we go towards the upcoming transition deadline, we're looking at how does that arrangement also give an opportunity for all of you in this meeting, whether you're a hospital operator, a credit controller, and the like, to be more efficient. And how do we make sure that even with the transition, there's no exposure, that there's no single day whereby you are losing patient revenue and also you're stopping patient care. So that's the first thing that we are looking at, a transition that is bringing efficiency. Then how do we make sure that there is a more efficient migration, especially looking at the historical workflows that are supported by the current HMIs, and how do we work with your vendors, the HMIs, to make sure that any missing parts are available even as they undergo certification? That's the other thing. How do we reduce that exposure and make sure that we remain open? Finally, even beyond the transition, and once you get compliant and once you're getting certified, is how do we give you the right technical support? Because from experience, we have seen just how fast things change, cross benefit self beneficiaries definition, the tariffs themselves, and how do we work with you, the hospital, the insurance partners, the vendors, the platform, the EMI, PS in the industry from the data exchange and side. How do we work together to make sure that you have the most current rules, and how do we bring good documentation around things that maybe our team knows, your team knows, and doesn't have to remain in the memory, in the memory. So we look this not, we don't see them as IT challenges. We see them more as revenue. And our answer to that is that how do you offer the technology that can hold the current rules for you and also help you to stay compliant and certified with DHA, and that you can adopt efficiently even as you mature your technology. Next. So we have worked for about 14 years in this industries, and what my customers say across insurance, across hospitals, and also what my peers in the industry say is how do you make sure that the rejections are minimal, and how do you do a technology platform that is reliable even as it scales? And when we follow one patient across a facility, we see that you have to have the right identity. You have to trust the identification method that's offered to you. The period must be very well documented, and it must be something that will lead to a payment. And the claim, unfortunately, is assembled at discharge, in fact, after the discharge step, and then there is auto reconciliation or manual reconciliation by Excel. What we see that if you don't have a good hospital management information system, then you bring a lot of paper data to the SHAP provider portal. But with the right technology, either our HMI solution or any other that you get certified with DHA, how do you make sure that as you progress through all these 5 or so steps, any challenges that you foresee or any challenges that are seen, you can fix it then? And our work is how do we work with you, your vendor, your technology partner, your technology team, your credit control team, to make sure that the right decisions are made early on. Thank you.
Yeah, thank you very much, Daktari, for setting the why. Then we have a look at the solution now itself. And what Daktari clearly said, we are bringing in a solution that will follow a patient having a portable record from one facility to another across the country without involving manual processes. Now, I welcome Abud Orina from Savannah Informatics to give a showcase of the product and maybe demonstrate some of these functionalities that will help providers have lesser pain when they're seeing patients. Abud?
Good morning, everyone. Good morning, everyone. My name is Abud Orina from Savannah. I will be doing a quick product walkthrough of the provider portal that we already have. So I'll quickly share my screen, and then I'll show the elements of the platform shortly.
Okay, as Abud just cast his screen, I think he's already back to the session. Over to you, Abud. Thank you.
Hello once again. So I'll be using my speakers for the room. So I'll start very quickly with patient billing, with patient registration. So as I mentioned earlier, this is a pre-recorded demo. So the first thing I think mostly we'll go through is how the application is packaged. So the application is packaged through multiple applications that you can quickly go through, and you can also right size the permissions in terms of who has access to both the patient data and what they can see on the screen. And for example, in this case, I'll move very quickly because of time. So I'll start with the front desk. That's where mostly all the patient registration is done. Anything to do with patients, check-ins, appointments are also handled from this section. I think there's already dashboards and a list and a calendar view that will help you with managing your patients. And then here we have a list of patients in the facility, whereby I will search for a sample patient that you've already pre-set up. And then the patient's profile already has everything to do with the patient. So there's the basic details, addresses, things like demographics, whereby you can add and update as necessary. We also have contacts and identifiers, so phone numbers, emails, fax, in case you want to add that. And then a lot of identifiers that you want to enrich to the patient's profile. We also have emergency contacts, and so in case you're looking for someone to contact the patient, consent and legal, account statements. So anything to do with the patient's billing and all that will be visible in these sections. And then, of course, enrollment. So when you're ready to see the patient, we will check in. For check-in, you will basically select whether it's a new, a review, or returning. This can be configured according to your facility settings. For the visit type, you're going to use outpatient consultation mostly. And then once you're ready to do that, we go to billing. So for billing, we have either cash or credit. For cash, you can either choose to collect now or collect later. For credit, you're going to either choose a corporate that you already have. It can either be corporate or just a general insurance. So all that is configurable and can be added to the platform. For this case, we'll choose cash and click on collect later. And then before you start the visit or check in the patient, you have to assign them to a queue. So in this case, we'll assign the patient to the triage section so that we can also see later on what the triage nurse will look at. Then you can set priority as per your facility operations. Any pre-visit checklists are also visible there. And then once we are ready, we can check in the patient to basically indicate that we've started their visit. And then in the patient's profile, for the visit context, there's eligibility where we are able to preview the patient's covers. So things like if they have private, public, all those will be visible here. We have authorizations for credit billing. There are some before you do any billing for the patient, you should do some form of authorizations. So that's basically asking the patient if they want to do that. And then pre-authorizations, then there's billing, which is what we'll show in a moment. Then there's the patient's invoices are visible, orders, and any payments they've made to your facility. Then for billing, the bill summary is visible at the top. To add an item, you click on the add bill item. And then when you click on the add bill item, we already have multiple price lists set up. So in case your facility has multiple price lists, you can select that. And then I'll search for at least a sample item. So maybe, for example, consultation. These are mostly things that are billed at the front desk. And then in case you have any discounts for your facility, those are also configured on the platform and the pricing will adjust. Then for the payer, we'll only we'll select self for now. Then we'll also showcase how we can build to multiple payers later on as we go on with the product demo. So in this case, I'll add, let's say, for example, paracetamol. This can also be handled for mostly for things like OTC, whereby the patient has come in for just medications over the counter. And I'll quickly add that as well, so that we show how many we can add multiple bill items to the patient's bill. And then once I'm ready, I save those items. So these scenarios are mostly handled by the front desk person. And then once we have these items, the next stage will be now collecting the patient's payment detail, basically the patient's payment. So they can pay through multiple places, whereby automatically will prefill the patient's bill, the full patient bill, and then you can modify as you wish. Then for payment methods, we have all payment methods integrated. So things like PesaPal, if you have a pedicure machine, you can do the payment. For M-Pesa, we have a query in case the patient has already paid before they get to the visit for things like consultation fee. You can query the amount. And then for the M-Pesa SDK, you can prompt the patient to their phone number so that they can make the payment. We also have a PesaPal integration as well, if you want to pay online, and then cash. So in this case, we'll do a cash payment for this visit. So I'll add that, and then I click on complete payment. Then the patient's bill is now marked as paid because we've already recorded the payment details. And then, of course, there are other billing items where, for example, you might want to preview the patient's bill in case you want to print it and send it to them. So that is also visible in this section. And then I think once we are done with the billing, that should be the end of patient billing. So next, I will quickly show you how we do triage. As usual, we'll start from the same starting point where the applications are visible, and then we'll search for consultation. So triage is located in the consultation application, whereby triage and also the doctor's treatment is also located there. So there's a lot of application I won't show because of time. So we'll click on triage. So the patient we assigned the queue is the last there, as you can see. And we can now click on start triage. So this is now being done by the triage nurse. Once we click on start triage, there's a bit more clinical context or clinical information you can see. So for example, things like conditions, allergies, medications, the patient profile is also visible above. To record vitals, you click on the new entry button at the top right. So I'll quickly fill in some details for this patient. So for this patient, we're treating a patient who has come to the facility with symptoms that are relating to something like malaria. And then I'm just quickly, in this section, we're just quickly filling in the vitals as you would in a facility. So for things like the vitals, they're normally validated against things like early warning scores. So I'll enter blood pressure of 117 and then maybe 76, a temperature of 38.2 so that we can show the elevated temperature for the patients. And then I quickly enter things like oxygen saturation, respiratory rate, and also media upper arm circumference. So I'll quickly save those. Once the vitals are saved, they are visible in the form of cards, which are also indicated there. And then in case you want to track things like vitals over time, you can also do the vitals flow sheet. These are mostly useful for things like inpatient workflows. And then I'll go back to the individual vital tab. And then in this case, we are majorly treating a patient who has malaria. So we'll quickly enter a chief complaint for them. So maybe a fever, headache, and joint pain, and then we save that. And this is what the doctor will see. I'll show you in a moment when you go to the clinical section. So any problems, any allergies that the patient has can also be recorded during triage. And then the problems and allergies have something we call templates, which are basically structured forms that you can use to fill in the details as necessary. So for example, I'll also open the allergy one. I think once we are done, we can click on complete triage, whereby we assign the patient to the consultation room so that the doctor can be able to see them. And then, of course, for the priority, you should be able to select a priority depending on your facility operations. And then once we're done with that, that will conclude triage. So in the next session, we'll quickly preview the clinical and triage treatment workflow. So for clinical and treatment, again, we'll select the consultation application, then click on consultation. And then this patient we queued previously from the triage section is already here, and you can see the priority is already indicated. Then I'm ready to see the patient as a doctor, so I'll click on start consultation. And then for consultation, you can see the visit is already indicated, any conditions that I have. The patient profile is visible across all pages. And then I'll start with the timeline. So mostly for what you're seeing here, triage is the things that the triage nurse entered. And then for the patient timeline is basically a historical representation of the patient's past visits and what was done in those visits. So you can see things like vitals, any conditions that were recorded. Then you can filter by date as you wish. And then we already saw triage. So problems, again, those can also be recorded in this section because they're the doctor. We are not able to add them because we have not started a patient exam. You can view lab orders, any imaging procedure. So everything about the patient is visible here. When you're ready to see the patient, we can now start an exam as a doctor. And then the first stage is to quickly preview what was entered during triage. In case you have anything else to add, you can add that. And then the chief complaint that was entered from the triage is also visible there. And then any allergies, problems are also shown. Then next is basically the patient's history. So for the patient's history, there's of course, you'll just basically record what the patient is telling you as a doctor. So I'll quickly record these vitals, these elements very quickly. So for example, for past medical history, there's no chronic illness. For family history, there's nothing significant. Maybe the patient traveled to maybe Kisumu recently. We can also view that. And then any medication history, things like paracetamol, for any medication they're taking currently, those can also be visible in this section. Once we're done, we click on submit. And then that is already saved. We'll preview later. Then for the review of systems, in this section, I think for anything that you have, if anything that you're evaluating is normal, you just indicate normal findings. Most of these are optional, so if you don't do it, the system automatically assumes that everything was normal, depending on how you configure it from your facility. And then in this case, we'll focus on musculoskeletal to showcase how you can quickly enter observations for review of systems. So in this case, maybe we'll enter some observation for the patient, which can be maybe like a joint or muscle pain, and then any review notes or things that you're suspecting will also be entered in this section. Once you're done with that, you save on that review of systems. We'll show how that will show up in the preview in a moment. And then I think from the information we have, we probably have like a rough idea of what the diagnosis would be. And this is the diagnosis that is normally entered into a claim, for example, if you want to submit a claim to SHA or any other payer that you have. And then so I'll quickly search for the patient's diagnosis. And then when we search for that diagnosis, in case you have any other custom assessments that you normally do, things like child clinics, you'll use the assessments option above. So we found the diagnosis. We are going to add it now to this, and then it's already provisional by default until you confirm. And then in this case, we're going to order 2 lab tests for this patient. So I think mostly it's going to be either a CBC or so mostly a full blood count and maybe an antigen test. So that's what I'm going to fill in. And then these are templates, so they are very structured in terms of how you fill in the information. So I've entered another reason. So for when it goes to the lab, that's what they will see. And then I'm going to enter some quick notes, in this case, maybe because of the patient's temperature. Then that will create the lab order for this patient. And then I'll quickly enter a full blood count as well. So, and then these items are mostly coded from the terminology service, so they're easy to find, and they will probably easily match to your facility operations and your current HMIs if you want to switch. And then for the priority, again, it's mostly selecting the priority for this order so that when the lab attendant is handling this, they are able to see. So once I've done my orders, I can now submit them. And then once they're submitted, they are visible in this section. And then as they are now automatically sent to the lab person will receive the notification, they'll perform the tests, and then they'll be able to do that. You can also order any radiology, imaging, any procedures that you have. And then when the results come back, they'll be pre-filled in this section. So in this case, it's already drafted, so the tests are in the lab being processed. And then the next stage, I think once the lab results are back, is mostly the treatment plan, where before we treat, we have to go back and I think confirm the diagnosis. So in an ideal scenario, you'll already have the lab tests, you'll already have previewed the lab results, and then you'll have a rough idea of what the treatment plan should be. So that's why we confirm the diagnosis, and then now we'll go to the next stage, whereby we'll now order at least 2 medications for this patient. So one maybe can be some paracetamol for their pain, and then maybe like a specific drug that is going to treat malaria. So in this case, I think, again, the same style. So the medications are coded by default. So you can either search by the name or the code. And then in an ideal scenario, I think because this is a demo, we quickly show you how we can pre-fill these items. So normally, if they are already coded, you'll see that the items will be pre-filled. So things like the formulation for this drug, maybe it can be oral, and then twice daily, maybe in the morning and also in the evening. And then you'll give this patient the drug for like 3 days. And then I forgot to select the evening option, but you can do that later as you wish. And then for the start date, I'll say maybe they started maybe taking it yesterday, and then maybe they'll end on first. So that is also configurable. Any refills you want to show are visible here. Any dosage instructions that can be printed to the patient, those are also added. And then once we're ready, we can add it again. So again, we'll also add maybe 1 paracetamol for clarity. So I'll quickly type the medication, fill in the dosage units. So 1 gram formulation is mostly tablets, oral for the route, and then try 3 times a day in the morning, afternoon, and evening. And then these can also, again, like I said, they will be printed and issued to the patient. And then so I'm quickly selecting evening. The duration will be 3 days, starting yesterday all the way up to the 1st of August. And then no refills, so substitutable. You can configure that. And then my orders are ready. My medication orders are ready. So once I submit, they are sent to the lab, the pharmacy, sorry, so that they can be dispensed. And then the same flow, I think, will also be there. So in the lab, they'll bill, and then they'll be able to dispense the medication. And then the final stage is quickly a quick review of the visit or the patient exam that we've already done. So there are no problems. You saw me enter the patient's history. It's already visible there. For the patient exam, we indicated normal findings. So this will also be in the patient's visit summary that is generated after the visit. And then any lab orders that were added, they'll also be visible here. So in this case, you can see there's already pending lab orders. The diagnosis was confirmed. So in an ideal scenario, you'll already have these as confirmed. So, and then once you're done, you click on confirm and sign off. So for now, we'll have a click to sign, but later on we'll add biometrics and OTPs and all those other authorization mechanisms for clinical providers to sign off on that. And then once you're done, you can click sign off on the exam, and then that marks the completion of the exam as well. And then you will also click on complete consultation to mark that as a doctor, I've finalized seeing this patient. So that will conclude the consultation aspect. And then the next stage will go now to the share billing process, whereby we are able to search for a patient and perform an authorization. So in this case, I think I'll speed through most of the sections because you're probably now familiar with them. So again, we'll go to the front desk. This is where most of the patients land when they come to the facility. I'll search for my pre-staged patients, and then I'll view their details. So again, I'll quickly check in this patient. So in this case, I'll choose it's a new patient. For the visit type, I'll just select outpatient. And then I'll go on to the second stage. You remember me saying about cash and credit. So in this case, we'll just select credit and then insurance. And then there's a third step that will be revealed where you can quickly check the verification for this patient. We'll do that in the next steps. And then again, we'll assign this patient to the billing queue. So that we can create an authorization for them for example, SHA interventions. So I've selected the queue, a pre-visit checklist, of course, and then I've checked in and added the patient to the queue. So in this case, we'll request the eligibility for this patient. And just as a note, this eligibility information has to be pre-approved by the patient. So there are various methods that we'll have available in the facility. So the first one would be the biometrics, of course. So either if you have a tablet, you should be able to do that. If you have a Windows machine, that can also be available. And then if you have so in this case, for any fallbacks, we already have things like consent OTPs. And then these are fallbacks for in case maybe your machine is not working at the facility. So in this case, I think we are waiting for the patient's OTP. So in this case, if the patient has received the OTP, we'll get it and enter it in this section. And then while we are here, most of this information that you're seeing at the top will all be masked. So I think the patient has received their OTP, and then we enter that. And then once we have entered the OTP, now we have access to the patient's intervention. So in this case, we'll choose the outpatient PHC, for example, because it's a quick demo scenario. And then in most cases, you'll have like a more sophisticated interventions. And then again, you saw, so there's OTP. We are going to use OTP for this case. For the authenticate option, it will also trigger like an SMS to the patient as well. And then for OTP, in this case, since this is a demo screen, you already see the OTP there. But in the real sense, you will request the OTP from the patient. The authorization has already been created, so you can see it has 29 days left, depending on the payer. The benefit is indicated there. So in this case, since it's SHA, that's by default, then the authorization items are visible here. You can add as many authorization items, so things like interventions, you can add more than one interventions, depending on how you would like to configure the patient's visits. Any pre-authorizations, any billing, invoices, orders, I think we'd already seen this. So in this case, we'll just quickly show you how we can split the patient's bill across multiple payers. So maybe, for example, the patient will have a 1 million bill, and then they can say 500,000 will be sent to SHA, 400,000 will be sent to maybe Jubilee or any other payer that you have. So I've billed consultation to SHA, and then I'll add that item. Then once we are done with that, you can see the authorization is already working. Then now in the next stage, we'll quickly go to the consultation application. So we'll send the patient to the doctor's queue so that they can be seen. In an ideal scenario, I think you saw me send the patient to triage so they can follow those steps. So in this case, I just want to add a quick diagnosis. So assuming the patient has already been treated and they're back to our visit, I'll quickly go to the consultation application, fill in the relevant details that we are looking for this patient. So the same tabs I think you saw me enter earlier on are visible. I'll quickly start the exam, go to triage. For example, in this case, our patient earlier on had malaria, so I'll quickly retype this as well. So I'll enter their chief complaint. And then I'll add any allergies that are there, those will also be added. And then for the patient history, I'll quickly populate these details as well. So the same details we had from earlier on that you saw me enter, those will also be visible here. So no chronic illness, there's nothing significant. The patient recently traveled, then they're taking maybe paracetamol at their home, and then they don't smoke. So these are quick notes you'll enter on a regular visit by the patient. And then we're going to assume that in this case, maybe we've already done everything we did in the previous steps. So I'll zero in on musculoskeletal, enter some observations from that. And then next is what now we'll enter the diagnosis that will be used to view the final bill for the patient and also the final claim. So I've saved the review of systems. Then I'll quickly type the diagnosis as well. So for the diagnosis, you can either search by the code, ICD-11 code, or you can enter it by name. So both options are available, and it's very easy to search. So maybe I'll say the severity is moderate, and then I'll add the diagnosis, and then I'll quickly confirm it because of time so that we can show it when we go to the final claim that is sent. Then I think in this case now I have a diagnosis. We'll already have maybe, for example, medication orders. So those will be visible here. Again, the same format that we used earlier on. So you can quickly type in the patient's medication and then the rest of the fields will be pre-filled. We're not going to do that because of time. So I'll quickly go back to now so I think for the next stages, after we go to preview the medication, we'll now go to the previous steps. So I think I'll cancel this. And then I'll move on to now the previous steps, which is step 5, I believe. Yes. And then again, similar to what we did earlier on, you'll preview the steps. And then problems, allergies, the history you saw me enter is also visible here. Any lab orders, procedures, treatment plan, all those are there for the clinician to preview. And then we'll confirm this visit. I think this exam is already now complete. And then the complete consultation to indicate that we are done with the patient. And then that should be that. Then next, we'll go to the front desk as well to preview the visit. So again, we'll search for the patient, view their profile, continue their visit, and then go to the bill section. So in this case, we'll quickly preview the patient's bill. So I think once we're done with that, we now complete the visit. So in this case, it's the front desk person doing this. So before we submit the bill or submit the claim, the patient has to authorize the amount that we are about to submit to the payer. So in this case, it's 1,500 shillings. So the OTP will be sent to the patient. And then in the meantime, so these are mostly done in the front desk. So the provider will complete the visit to indicate that it's complete, and then the visit will be locked so that it can not any other modifications can be done for this visit, and then now the credit control team can take over. So we will quickly verify the OTP that came to my phone, and then once we're done that, we can now view the claims for this visit. And then for the claim, as you can see, it's already draft. We have claim readiness checks against a rule engine that is configurable depending on the payer that you have. So if a payer requires 5 documents, those can be configured. So you can see this is how a claim would look like. So we have the things like the authorizations that were done, the benefits that we are also basically adding to this claim. Any billed items. So you saw me add consultation as a bill item earlier on. That is also visible here. And then coinsurance, any coinsurance in case the patient has any co-payment that they're making, that is also visible here. The diagnosis you saw me enter in the clinical stage is visible here as well with its relevant code. And then any required documents. So in this case, for example, we require the claim form and maybe the final bill. Those are also available. Then I think once we're done, so you also have an option to check for claim readiness. So in case maybe any documents have already been attached from the doctor's side, for example, those can be visible here. And then now, in this case, this claim is ready to submit. So I think that concludes the consultation. And then for the visit, of course, the front desk person has confirmed that the claim is okay. Now they'll go ahead and complete this visit. So completing that visit now is what locks the visit from any changes that can be made so that the visit or the claim can now be ready to be sent to the payer. Now, in case you want to book an appointment for the patient, this is also available. So in this case, you can book an appointment against a list of services. So we're not going to do that for now. And then we'll go back to that visit to quickly show that it's already been finished. Then we'll quickly go back to the application. Now, in this case, it's the credit control team that is now taking over this claim so that it can be submitted to the payer. So again, every application has its own dashboard so that the person attending to that workstation can be able to see quick analytics about them. So in this case, it's analytics for the credit control team. I'll quickly show you analytics a bit later. So again, we'll also view this claim. So you can see it's already, the status is already in draft because you've not submitted the claim. Billed items are already there. The coinsurance, I think now you can see that the final bill, since the visit is closed, has been generated and attached automatically. We are not doing any attachments, but you can do that in case you need, depending on your hospital operations. Since this claim is ready for dispatch, we will now dispatch it. And then once you click that, now I think the claim is now ready for dispatch. And then for claims, you can batch them depending on the payer. For SHA, you will only send one by one. And then for any other payer, you can quickly select, let's say 5 or so claims, depending on how your operations look like at the end of the day, and dispatch them all at once. And then, so we'll preview the visit again. I think that should be the end of this section. So there are other elements that we want to show in a moment. So things like transaction logs can also be visible for this claim. So in case you want to track where the claim is as well, that can be done as well. Okay, and then for the next set of sections, I'll quickly show you the visit to show you a few more things. So the first one is now we'll go to the consultation application. No, we'll go to the front desk to quickly show you a few things. So the first one is the invoice. So once everything is done for this visit, you can preview the invoice. I think I mentioned this earlier on. So the invoice details are there. This is a printable document that you can do for the patient. You can either do for your operations, also send to the patient. So in case Savannah is already an eTeams compliant integrator, so we are going to showcase how we are going to sign this invoice. So once the invoice is signed, then anything to do with so all items details are attached to this specific invoice. So you can see the VISCO information is already visible there. So it's a virtual device that signs this invoice, and this is how the structure of the invoice will look like. So in case any patient requires an ETR, that can be given to them. So yeah. So that comes to the end of the billing section. Then the next 2, 3, 4 minutes, I'll quickly show you the Quintus module. So in this case, there are 3 levels of analytics. So there's the high level analytics. So the platform comes with an application called Quintus, which mostly serves analytics for everyone in the facility. It could be the execs, it could be maybe the head of, for example, credit control. All those are available. So in this case, I'm quickly showing the executive overview dashboard for a hospital manager or a hospital admin or the owner of a facility to track things like revenue, how your patients are doing, the split between maybe visit, for example. You can also track service delivery for your facility. So things like the patient's life cycle, the split between new and returning patients. And then any things like patient acquisition rates, retention rates for the patients, how many are coming back, the average visits per patient. For example, in this case, for this test facility, it's 3 visits per patient. And then you can see the split by the visit type. So this data is filled in real time as the operations go on. So you can quickly check in as a facility owner or maybe a department owner, how your data are doing at specific points of your day-to-day. So things like revenue. We also have a suite of financial performance dashboards. So things like how the revenue for the facility is doing, gross margins, average revenue per visit. You can view trends as well. So gross profit. You can also view by payers as well. Any cost analysis, so things like cost of goods sold, the average monthly cost, the cost per visit. So those are insights that we have embedded onto the platform. And then we also have dashboards for revenue cycle management, which track the end-to-end revenue cycle management process. So things like claims throughput. So you can be able to track how your claims are doing, any submitted claims, any collections that you've done, any accounts, any rejections, maybe from the payer. You can also be able to track that. And then we have a section called provider operations, whereby you can be able to track basically anything to do with your facility. This also works in case you have, let's say, 3 or 4 branches for your clinic. And then there's also a section called clinical performance, where you can track basically the performance of your clinic. And then these can become as customized dashboards, so you can customize for your facility as needed. And then things like medication access, those can be tracked as well. Diagnostics and labs, those can also be viewed. Disease burdens, those are also available. And then we also have things like MOH reporting, that is also available, so that you don't need to fill in the manual forms. You can quickly generate them from the platform and submit as needed for your reporting needs. Then quickly, I'll show you how so I think I mentioned earlier on that each application has its own dashboard. So in this case, this is, for example, front desk. So there's 2 types. So there's the quick overview dashboards, where you can quickly preview things like appointments, how many I have today, how many I've completed. And then there's dedicated dashboards for each where you can preview things like now in detail. What are the bookings today? You can filter by as needed. And then I think I already mentioned MOH reports as well. Those are also visible in these sections. And then you can track things like appointments, missed appointments, any no-shows, and then the percentage of appointments that are shown. So in case you want to do any interventions like calling the patient and maybe requesting them to join, to come to the facility for clinic. And then we also have visit analytics as well. So this is mostly for the front desk person. So each of them will have their own set of dashboard they can track. And then this can also be used in your internal review meetings, whereby you're maybe tracking things like operational excellence, for your facility. I think that's mostly everything to do with Quintus. I think I'm done with the product demo. Thank you for your time. I think I'll stop there to hand over to Millicent for any questions.
Yeah, thank you very much, Abid, for that elaborate demonstration. Yeah, this could take even more hours so that we get 100%, but we've summarized. So here we are looking at a solution that runs your facility and speaks to national rails without you thinking about it. So all the things we've shielded you from, your job is just to serve patients and to maybe monitor your revenue cycles. So we have 8 modules in summary of what Habib has said. And these 8 modules formulate only one record for the patient, which is portable and can be moved across the clinic. So if a patient is seen in Garissa town and they happen to be in Busia, at the same time, they'll have that longitudinal record following them across. So in summary, Abid, you've done well. We have 8 modules that we can summarize here. 1, registration and identity. So we have one verified identity. The record follows the patient across visits and across sites. Regardless if a facility like Aga Khan or Avenue have branches, that record will just follow them. And regardless if your patient is seen in an Aga Khan or Avenue or in other places like Rufa or whatever it is, that record will be there. Clinical encounter, so we are basing on standards. Everything is coded and there is no room for errors, no room for writing things that cannot be interpreted that much. So we are looking at the HIE, and within HIE we have standard terminology service, CD11, glowing, SNOMED CT, and so on, so that the patients can go without having any challenges. So making sure that eligibility and pre-auth are done beforehand. So this matter of rejections of claims and everything are handled at a client level before we post them to the server. Then billing and claims, you mentioned clearly that we are eTeams compliant and KRA manuals are covered here. So claims will be cleared without any hitches for that end. Then pharmacy and dispensing, everything about whatever a doctor prescribed is what is dispensed at the pharmacy. And if there is any problem, then it needs to be advised from a doctor's level. So everything that is pushed is what is dispensed and it is known beforehand to the patient. Then in inventory and stock, we are making sure that the stock levels and everything within the facilities ranging from non-pharmaceuticals, pharmaceutical staff are put into place at the right time and warnings are given when necessary. Then it's statutory reporting. You mentioned about MOH reporting, analytics, and even custom reports to the facilities based on what they did at that time. Then in case of any revenue leakages, we are looking into that before things happen. So we advise the provider before they submit to the payer. So the objective here is to have one record that runs across. So if we don't have such a solution, it will mean that we have several other systems. You will find a facility running a pharmacy system separately, a finance system separately, another system to view patient and so on. So you will find that one patient appearing many times within one facility in different systems. So linking them together and getting a summary of all those patients within that settings becomes a problem. But here we are putting everything into one roof, give you a one portable record that is based on standard. And here we're talking of HL7 fire standard that makes summary that is shared centrally for this patient to follow this record across patient care. Millicent?
Thank you so much, Ngozi and Abud, for taking us through this particular session regarding the HMIS. We are very grateful. And for all those who have some questions, kindly feel free to drop them in the Q&A. Now we are about to get into a very interactive session whereby we'd like to ask you a few questions based on what we have garnered so far through this presentation. And just to make it even more exciting, there will be some gifts at the end of the session. So kindly allow me to introduce my colleague, Irene Musila, who will take us through this session.
All right, thank you so much, Millicent. Thank you to the team for that walkthrough on the HMIS. I hope you're taking notes because that's about to pay off. My name is Irene Musila from Savannah Informatics, and I've got the fun job for the next few minutes. We're switching gears from listening to playing. So here's how this works. Winners, over to you, Millicent.
Right. Irene, thank you. Thank you for the session and congratulations to everyone who participated. Now we want to change gears a little bit fast. Now let's look at the existing healthcare facilities, how they can integrate within the solution we are giving. Allow me to welcome Paul Mutinda from Savannah Informatics, who is the CEO, who will explain how facilities already using existing HMIS platform can seamlessly connect using our RAINS approach. Karibu Paul.
Yeah, thank you, Ngozi. Good morning. No, we know that most of the facilities already have HMISs that they've invested for a very long time, that they've actually used they have their money and time, and we don't want to come and change how you are working. Our aim is also just to come in and plug you into the National Digital Superhighway, and by that you can be able to, let's say, use your system just the same way that you use a provider portal platform. Go to the next slide, please. Yes. So what we are providing is what we are calling the rails. And the rails, this one is for clients with existing HMISs. So we provide you with APIs that you use to connect to the National Digital Superhighway, and you can be able to submit your claims and also pre-authorizations through your HMIS. And for the place, for the functions that your HMIS does not run, then we can provide the alternative screens to be able to make you do those functions. So we are not coming to replace your HMISs. What we are doing is we are enabling your HMIS to be integrated and be compliant with DHA. And this is also for the HMIS vendors. We are not coming to compete with you or fight with you. So what we do is that we work together to ensure that your system connects to the digital superhighway and also becomes certified. Next, please. So how we can be able to do this is that we can have a full API integration whereby everything is done through your system. So your system just calls our APIs in the back, and what the users see is only the HMIS. And by this is we do all the way from the biometric verification to the claim submission, and also be able to run rules such as code combinations and make sure that all the necessary attachments are there before the claim is submitted. We call this lightest because you don't have to train your users on new flows or new UIs. They use what they already know. Then the middle is where, let's say, your HMIS does not support, it will take some time before it supports things like, for example, biometrics, verification of rules, and also requirements of documents, packages, and interventions. So we able to do like some things are done on your HMIS and some other things are done on the Rails. And for this, the users will have to switch between the two systems to do work that your system cannot be able to do. And then the last is where you're using both our system and your existing HMIS. This is heaviest because there's a lot of dual input of data, and also the riskiest because risk of transcriptions and mistypings, which can lead to revenue loss. And I think just go back to the other slide. Yes. And what will determine the kind of approach that we use here would be the system that you use. Is it a current system? Does it have APIs? Is there support from the vendor? Do you even have access to those APIs? Or you need to get them as a separate module? Do you have access to the database and so forth? And this is work that we already have experience with, given that we've integrated with over 80 hospitals in the country. Next. So, as I was saying, for the Rails approach, it will depend heavily with your vendor's cooperation and whether they can be able to consume our APIs, or we can be able to pull the data from your system or database. And we'll also publish API documentation and file resources so that if you're a HMIS vendor, you can actually do the integration yourself. So as we just come in to validate that you're using the APIs correctly and that what you're doing is succeeding. So this one is completely vendor-led. So we just provide you with the credentials and the vendor does the work themselves. And to make all this good, we say for all the clients, we require someone who is from the client who will be the project owner. And we'll also need access to your system if we are the ones doing the integrations. And what we want to promise you is just to, like, if we begin that journey, then by the end, we are going to have a system, still use your system, have a system that is, you don't have to retrain your staff or with minimal retraining of your staff, but we do not stop your processes and change your processes so much that it becomes a headache to you. Yes, back to you, Ngosi.
Yeah. Millicent?
Yes, thank you so much, Mutinda, for that wonderful presentation. For any person who still has some questions on the chat, we are winding up and we're getting into the Q&A session. So kindly allow me to invite Ben Lusweti and Dr. Fred Angwenyi to address some of the main questions as time allows. Dr. Fred?
Yeah, hello. Thank you, Millicent. Yes, so there were a few questions on chat, so we'll try and answer them one by one. Some have already been answered and some have not been answered yet. So the ones that have not been answered, we'll answer them. So give me. Yes, so thanks. So one of the most common questions is about DHA certification. So are we DHA certified? So the answer is we are working on it. So not yet certified yet, but we're working on it, and that should be done as soon as possible. Another question was on the system. Is it free or at a cost or facility? It comes at a cost, which if you contact us after this particular webinar, we're able to share with you those details. Another question was on the SHA integrations. So yes, so I think currently in the country, I think with the people with the most experience with SHA integrations, that's not a problem. Everything comes integrated. Another question will be on the different facilities. So what we showed was for a high-level facility, but if you own your own clinic or you have a level 2, level 3, we're able to customize our modules to fit particular needs. So don't worry about the complexity. That is just for a level 5 facility. But if you have a lower level facility, we're able to do that for you. I think I can stop there, allow Ben to answer any other questions that I've left out. And also kindly, you can also send more questions on chat if we haven't yet answered it.
And as Ben also prepares to join us, I think there were some questions on our demo as well, which my counterpart, Mr. Abud, will also facilitate once Ben is done. Thank you.
Okay. Thanks, Dr. Fred, and thanks, Millicent, for that. I think most of the questions have been answered. Just to maybe tackle, rather insist on one that I've seen. Yes, we are ETIMS compliant, and you can be able to sign through our platform, that is the HMIS, and you will be able to sign it as it is compliant with ETIMS. Then I also saw a question around other private insurances. Yes, other than SHA, we are able to provide a way where you can be able to even bill the private insurances and also the cash payments or other cash patients. Just an overview of how my colleague took us through. We're able to do the SHA billing, we're able to do the cash billing, and also the insurance, private insurance billing. So it's a whole system that has all the workflows and all the workflows that you can be able to imagine or think about, just that you use for patients' cases. Yeah, so I think a majority of them have been answered. I see there are a bit more questions around pricing. For them, just make sure that maybe you're able to sign up for the link that I've posted there so that we're able to give you more details, customize them according to the facilities that you have. Don't shy away from signing up. It's just a matter of signing up. Then we can be able to provide more details as you request at a personal level. I think most of the questions have been tackled, and if there's any that maybe feel it has not been answered, feel free to raise up your hand and we'll give you a chance to ask the question. Thank you.
Thank you, Ben. Orina here again. I'll answer some questions that were raised during the demo. I think I didn't have a chance to have a look. So because of time, I'll quickly address them one by one. So the first one is a limited diagnosis. So I think you saw me search for a diagnosis on the platform, either by code or name. We have already loaded all ICD-11 codes on the platform, and they are available for searching. There's also someone who asked about paper documents. So I think there's nowhere in the demo that I uploaded any documents from the video that you saw. So most of the documents are automatically attached. So for example, things like the final bill, you saw me close the visit and the final bill was attached to the claim. There was no uploads. Yes. And then for private clinics that don't have SHA, the HMIS will also work for you. You saw me show several modules: patient management, triage, consultation, Quintus. There's a lot that you can gain from there. The system doesn't have to work only for SHA. It can also handle your operations. And then for things like countersigning of the claims, for example, by the doctor, You saw me during the demo click on confirm and sign off. That is automatically regarded as the doctor signing off. And I also indicated that there'll be future options to add things like biometric attestation for the doctor, and also things like OTP consent and any other consent mechanisms we have. So once that is attached, that is already automatically attached to the claim and also visible for the payer when they are reviewing. So I think that's it. And then for imaging on referrals, that is also accounted for on the platform. There are several modules I was not able to show because of time. Things like the lab module, which handles any lab tests. Things like imaging, which also handle things like images. The nurse procedure workstation, which handles any procedures that you have. And then you also saw me show things like any lab orders, pharmacy, all those are. There's already separate modules that handle that. And then for the length of service, someone commented that the demo takes quite a while. Yes, that's correct. But then in an ideal scenario, the patient will be moving through different service points. So for example, the triage will be handled by the triage nurse. The front desk billing will be done by the front desk person. So the video was like an end-to-end journey of the patient, but ideally, the front desk can maybe take, let's say, 3 to 4 minutes per patient, or even less than that, depending on your operation. So the system is not like a hindrance to any of that. And then for things like claims, rejections, and submission, I showed the claims tracking process where you can be able to track things like transition logs for your claim, any documents that are the status of the claim as it has gone to the payer. You're also able to visualize and view that. And then if a claim is rejected, depending on what the payer entered, the status will change to rejected, and the rejection reason will be indicated as part of the details of the claim. So any information updated on the payer side is also shown on your side. And then from that page, from the claim management page, you should be able to do anything like resubmissions and attach any relevant documents that they might require automatically through the system or manually. And then someone asked about biometric enrollment. So biometric enrollment is available on the platform. It will work similar to what SHA has. So if you have any biometric reader, the Secugens, all those, they are available on the platform. We've already done an integration for that. So the platform, if you sign up and you're on a Windows machine or an Android tablet, you should be able to have biometric authentication and authorization available to you by default. And then there's a question, the last two, there was a question around integration to the client registry. The platform is already integrated to the client registry. So during registration, the patient you saw me search for are already linked to the client registry. And during the registration process, if I had time, involves a registry verification where you are able to search the patient's details, the patient's details as they are on CR, and then you can put them to your facility. Then the final question is about user access and audit controls. So the platform is packaged in different modules, like I was able to demo to you today. So things like the consultation application is only available to the doctor. The front desk application is only available for the front desk person. The credit control module is accessible to the credit control team alone. And then the platform is customized so that your IT admin or facility admin can be able to grant multiple roles for depending on your operations. So for example, if you find that in your facility there's a front desk person who does triage, that is also, they can be assigned the front desk application and the consultation application and limited to only access the triage module within the consultation application. And then every action on the platform is logged by default. So you'll easily be able to go back in time and see who did this. All actions on the platform are automatically attested by the person who did that action. And then finally, I just quickly shared some clarity on the bill splitting. So I think there were some concerns around that the platform only handles SHA. That is not the case. We handle SHA, private, public. You saw me when I was starting a visit or configuring the check-in process, I was able to select either cash or credit. And then for credit, I was able to select either corporate or the general insurance. So depending on that, then you can configure the visit as you go. And then I also spoke about the example of, let's say, a 1 million patient bill for the patient, whereby 500K can be handled by SHA, 300K can be handled by another payer, and maybe the patient can be, let's say, 100,000 out of pocket. So you should be able to select that during the billing workflow. I think those are the questions I was able to handle. And then based on that, I think if you have any other questions, you can send them over to the chat. We'll try and reach out after the meeting to give you more context. And of course, you can also sign up for any customized demo that you might want. Thank you. Have a good day.
Yeah, thank you, Abid, for that clarity and responding to questions. There are some links shared in the chat where you're requested to fill in so that we can come to you later. And some of the integrations documentation that was shared by Dr. Mbe for that case. I've seen 5 hands raised, and I would like to give them a chance, maybe 30 seconds each to speak. Those who can allow them to do that, I'll now sit and mute and speak.
Thank you, everyone. I can see that the link, people are still being able to ask various questions. So allow me to introduce my commercial director, Joy Kiguta, who will also just take a few minutes to take you through some of the questions that you had asked, and we can wind up.
Thank you, Millicent. I hope I'm audible. Before I get on to answering any questions, I think I can give Dennis an opportunity to ask the question that he has. I think you're able to unmute, Dennis Munene. Am I audible?
Hello, everyone. I wanted to ask about eTeams integration, but Dr. Fred has been able to answer. Thank you so much.
Okay, thank you. Samed Center. Samed Center, your hand is raised. If they're not available, we can go to Ivan Warre. Evan Warre. Okay, Eunice Ngie. Agatha. Beatrice. Okay, I think they pressed by mistake, but I saw Graham Kimani just raised his hand. Yes, Graham. Okay. Since the questions are not forthcoming, I'll just want to respond or make a few things clear. So the first one is on the different approaches we have. So what my colleague Abud took us through was the product, the HMIS, which is suitable for those who do not have HMIS. And then my colleague Paul took us through the different approach we have for those who have HMISs and are not willing to move away from the existing processes. We are able to provide an integration, but the only caveat for that we need to make very clear is your vendor for the HMS that you're currently using still needs to get DHA certification. And my colleague, Dr. Mode, has put a link on the chat box on how you can go about certification. Then the third thing that I wanted to make clear is in terms of pricing. We have different pricing models depending on the size of the facility, the number of users you have, or desks that you have within the facility. Then we have those who will come in as integrators. So depending on the level of integration, then that will be at a different price. But the model that we're adopting is there is no installation fee, except if you want to have a deep integration that will be done on to your existing HMIS or to your existing ERP. So the pricing is more flexible in terms of what can be afforded by the different levels of facility and the amount of work that would need to be done if the integration route is to be used. We will share the link again for DHA certification, which we encourage all system vendors to use. And we are here to work together and to guide you through the process if you want to integrate and use our Rails for your facility. Then the other thing that my colleague Abid had taken you through was the analytics side of things. So how we've been able to package all this information, whether it's clinical or revenue or just on patient visits. So whatever sort of analytics you would like to be included within your package, then we're able to provide that as well. So a lot more conversations will happen once you have signed up for just a callback from one of our colleagues, and they'll take you through the different processes or the different approaches we would use depending on the size of your facility, and then we should be able to send a quotation. I think that was basically it. We should be able to publish also the slides as well as the conversations that we've had during this webinar for you to go back and review. I think I have answered all questions, especially related to integration. So there are different types of integration, whether you want on the clinical side, whether you want help integrating to CR and such like things. We're able to take you through that process, but underlying is that certification still needs to happen for other HMIS vendors. Thank you, Millicent and Nicholas.
Thank you so much for that, Joy. As we come to the end of today's webinar, thank you all for joining us. Please don't forget to scan that code. I know some of you had raised up your hands and were unable to unmute your mics, but we will ensure that all your questions are actually answered. We hope that today's discussion has provided valuable insights into how digital healthcare solutions can help strengthen your organization. And if you're interested in adopting this HMIS platform, remember the registration link has already been shared in the chat and is also available via the QR code. So on behalf of Safaricom Business and Savannah Informatics, thank you for your time. I want to also hand over to my co-host Ngosi, who will also announce who the winners are and what goodies there could be. But otherwise, have a lovely day and we look forward to partnering with you.
Yeah, thank you very much, Millicent. And asante sana for everyone for joining. I think this one has been very insightful for everyone. And we're looking forward to serve patients better and make a difference. For the 9 questions that we undertook today, those who are very attentive, fast learners in class, will get a gift, and that will be airtime of 1,000 shillings each sent to their phones numbers. So through registration, if you give us a correct phone number, we'll get that airtime. Maybe Irene, you have the winners, you can display them so that we see for clarity, so that we don't end up giving the wrong person. Irene, if you're here.
We do have the winners. We'll definitely now communicate with the winners and reach out to them directly.
Asante sana, and I think we come to the end of the session. Let us keep discussing. Let us be available in cyberspace going forward. The winners, Morris. John. So those winners will be communicated directly. If you have your contacts, then you get your airtime for that. Yes. Asante sana. Make sense?
No, thank you so much. Have a really wonderful day. Asanteni.
Asante. Bye-bye.